Hi, this is George with 573 Medicine, and today we're going to be talking about the anatomy of the pelvis. So let's get started. The pelvic region divides the abdominal region from the thigh, and the parts of the pelvic region include the pelvic bone and the pelvic spine. The pelvic bones, we have two of them, are further divided into three parts. The first is the ilium, which is this sort of blade-shaped and largest part of the pelvic bone. The second is the pubis, which is the lower limit of the suprapubic region. And then the last is the ischium, which is the most inferior and posterior part of the hip bone. The pelvic spine is what's going to connect the two pelvic bones posteriorly. And this is going to consist of the sacrum, which is this sort of kind of triangular shaped bone made up of the S1 to S6 vertebrae, as well as the coccyx, which is going to be your tailbone. The anterior connection between the two pelvic bones is going to be the pubic symphysis or the symphysis pubis. The pubic tubercle is going to be this ridge right here, and it's a rough ridge that extends to the upper border of the pubic symphysis. And between the pubic symphysis and the pubic tubercle is going to be the pubic crest, and this is going to be the attachment of the rectus abdominis and the external oblique. So next, let's talk about the iliopectanal line. So this consists of the arcuate line, which is the ridge that transfers weight from the sacroiliac joint to the hip joint. So what connects the sacrum to the ilium and the hip joint, so the connection between the femur and the pelvic bone. The next is the pectineal line. And the pectineal line is going to be a ridge on the superior part of the pubic bone. The next structure we're going to be talking about is the iliac crest, and this area has an abundance of red bone marrow. So areas are used to collect. So this area is actually used to collect stem cells for bone marrow transplants. Additionally, at the top of the iliac crest is the L4 vertebrae, which is a landmark for lumbar punctures. The next structure we're going to be talking about is the anterior superior iliac spine, or ASIS, and this is the attachment for the inguinal ligament and sartorius. And this is an incredibly useful landmark clinically because, for instance, when people are doing physical exams to diagnose appendicitis, McBurney's point is 2/3 of the way from the umbilicus to the ASIS. So that's it for this video. If you like the video, please like, comment, and subscribe, and feel free to email us anytime at realtalkmeded@gmail.com for any comments, questions, or